Good morning, Dawn. I'm here to do my teaching plan for insulin pumps. So, hold on, I have my computer over here. My nursing diagnosis for diabetic keto, for my patient, she had diabetic ketoacidosis for like the second time. She's only 16. She's just not very compliant with her insulin. She even told me that she hadn't checked her blood sugar in 2 weeks. Really no reason, just non-compliant. So my nursing diagnosis was knowledge deficit related to poor understanding of the disease process as evidenced by poor compliance with diabetes. Okay, just give me 1 second here. I'll get rid of that. So I have my outline here, which I'll send to you in an email, along with all the links to the videos I'm going to show you. So my first one is cognitive. The patient will be able to explain how often they will need to change their insulin cannula and refill the insulin cartridge thing. I would explain to her that she needs to be changing it every 2 to 3 days, both things. I also have a video that kind of shows how to do that, and I'll show that in a minute because it goes along with my psychomotor thing too. The supplies and equipment that she needs is an insulin pump, the cannula, and the actual insulin itself. And for a method of evaluation, I would do a post-test, and I would get her like a calendar or a planner and have her write down every 3 days what she needs to do and what days of the week she needs to change that, and then it would be an easier way a visual way for her to keep track, because I know I would forget that pretty easily. For my psychomotor, I had that the patient will be able to insert insulin pump needle and cannula to the appropriate area of the body, and I have a video for that, which I'll show you in a minute. My cat's watching. The equipment that she needs is the insulin pump, the cannula, the needle that goes in, the insulin, hand sanitizer, or she could wash her hands, and alcohol prep, or I keep wanting to call them prep pads, wipes. And then for a method of evaluation, I would have her do a return demonstration on what she learned. So I'll show you the video here. I'm gonna turn you around. How do I turn you around? Well, this is fun. Well, anyway, I'll just have you, I'll send you a link too, but
how to use the VeriSoft infusion set. To begin, you will want to work on a clean surface. Be sure to wash your hands and clean your insertion site. Please refer to your healthcare provider's recommendations when selecting an insertion site.
ow,
First,
Cardi.
remove the contents of your set. Hold the introducer needle with one hand while gently removing the front half of the adhesive backing paper with the other hand. Be careful not to touch the introducer needle when removing the adhesive backing paper. Now, carefully remove the needle guard by first twisting and then pulling. Prepare to insert by pinching the skin at your insertion site with one hand to lift the skin away from the muscle tissue. Now you can insert the cannula. Release the pinch, leaving the cannula and the layer of fat just below the skin surface. With the cannula inserted, secure the front piece of adhesive to your skin by pressing down on the adhesive tape. Next, remove the introducer needle. Place one finger in front of the clear window. Squeeze the sides of the introducer needle with the other hand and pull the introducer needle straight back. If you experience difficulty removing the needle, you may be pressing on the needle with your forefinger. Try straddling the needle with 2 fingers to secure the adhesive tape while you're pulling the needle out. Now, place a finger in front of the clear window to secure the cannula. Carefully lift up the back of the adhesive tape. Remove the remaining adhesive backing paper. press the adhesive tape firmly to secure the infusion set. Next, attach the infusion set tubing to the tubing lock connector on the cartridge. Twist the tubing lock clockwise until finger tight, and then twist another quarter of a turn to ensure a secure connection. Remove the circular protective cap and fill your tubing according to the instructions in your user guide. When filling tubing, hold the connector needle pointing down. Fill until you see drops of insulin come out of the connector needle. Make sure there are no gaps of air in your tubing to reduce the possibility of interrupted insulin delivery. Never fill your tubing while your infusion set is connected to your body. Next, connect your filled tubing to your infusion set by holding the connector needle at the point where it connects with the tubing. Be sure you have the connector needle right side up to properly connect to the site. Insert it into the cannula housing. You should hear a click when it connects. Fill the cannula with 0.7 units. You are now ready to resume your pump and start delivering insulin. You've successfully completed the insertion. Always check your blood sugar 2 hours after inserting to make sure it's working properly. You may want to temporarily disconnect from your pump at times such as showering, swimming, and contact sports. To do this, always disconnect from your site by gently squeezing the side tabs and pulling the end of the tubing off the cannula housing while holding the tape with your other finger. Cover the connector needle with a circular protective cap and insert the disconnect cover into the cannula housing until you hear a click. Never disconnect at the tubing lock. To reconnect, remove the circular protective cap. With the needle pointing down, fill the tubing until you see insulin drip from the connector needle. Now, remove the cover from the cannula housing. Place your finger in front of the cannula housing and push the connector needle straight in until you hear a click. We hope you found this video helpful. If you still have questions about infusion sets, please contact customer support at 877-801-69.
So that was just a little video on how to, teaching her how to change the cannula and where to put it on the body. And like how often she needs to change it. I thought that was really helpful. I had no idea they had to change it every 2 to 3 days, and that it was like, it seemed kind of extensive actually what they need to do to prime the line and all this other stuff. So I just thought that was a good video that she would be able to watch over and over again if she needed to every time she did it. And then my last thing is the effective outcome, which would be patient will be able to express on how to use how the insulin pump works and how they feel about this, how having diabetes makes them feel, how they feel about having the insulin pump. People are going to be able to see it, so she might have some body image problems because of that, because a lot of people are going to stare and wonder what it is, because a lot of people don't know what it is, especially children. She's only 16, so I'm sure it would be kind of rough to have type 1 diabetes that young and try to manage it on top of everything else that they do. For the selected teaching strategies, I said a discussion, express feelings about having the insulin pump, making sure that the patient has all of the necessary supplies they need before going home. I would provide handouts and any supplies needed for home, and method of evaluation. I would ask them if they have any questions about how to use the insulin pump and give them the number of the clinic to call if they do have any questions about their insulin pump. And I forgot to talk about the purpose and the goals, so I'm going to go back and talk about that. The purpose of this teaching plan is to provide the patient with an easier lifestyle and to administer a more accurate insulin dose to hopefully help control her blood sugars, and hopefully just make it a little bit easier for her to give insulin if she's like out and about. You don't have to bring the insulin pen with and all this other stuff. In the goal, the patient will be able to use their insulin pump independently. So that's my teaching plan. I think I covered it all. Thank you.